In 1919, meth was first synthesized, and it was supposed to be a substitute for ephedrine, and you could use it like through a shot. And then in 1960s, a lot of labs popped up in California, and they started mass producing it. In 1980, D-methamphetamine hydrochloride, aka crystal meth, was developed, and it is more potent and it is smokable. And then that spread throughout the entire country and is now used more for recreation than it is for actual medical uses. In 2008, nearly 13 million people ages 12 and up reported using meth. Of those, about 500,000 are regular meth users.
Methamphetamine is classified as a stimulant, meaning that it increases heart rate and respiration rate. It also stimulates the central nervous system, which is composed of the brain and the spinal cord. The only real positive effect of meth is that it was once used as a pain reliever.
Meth addiction rates have tripled over the past 10 years in the U.S. 43% of addiction treatments have been for meth abuse.
There may not be a lot of positive effects of meth, but there sure are a lot of negative ones. And for instance, the short-term effects are loss of appetite, increased heart rate, blood pressure, and body temperature, dilation of the pupils, disturbed sleep patterns, nausea, bizarre, erratic, sometimes violent behavior, hallucinations, hyperexcitability, irritability, panic and psychosis, convulsions, seizures, and death from high doses of meth.
According to the Foundation for a Drug-Free World, 93% of patients in treatment right now will relapse. As well as the short-term negative effects, there are long-term negative effects, like permanent damage to blood vessels of heart and brain, high blood pressure, heart attacks, stroke, and death. Liver, kidney, and lung damage, destruction of tissues in the nose if it's sniffed, respiratory/breathing problems if smoked. A meth addict, on average, will live 5 to 7 years while addicted to meth, so it is imperative to get help soon.
There are different types of treatments and therapies for meth addicts, like behavioral therapies such as cognitive behavioral therapy, contingency management interventions, and the matrix model, which includes a 16-week behavioral therapy, family education, individual counseling, 12-step support, drug testing, encouragement of the individual for non-drug related activities. Also, medications can help, but they can't counteract specific effects and can't solve addiction by itself.